Okay, we're going to pick up the last little bit here and talk about what's actually happening at the tail end of pregnancy here. So, um, we left off with the blastocyst, which was that hollow ball of cells in the uterus there becoming implanted. So, the blastocyst actually is composed of this outer kind of sphere of cells called the trophoblast, and then this inner cell mass. This is that cluster of cells kind of off to one side. And this is actually, we develop from this part, and then the trophoblast will ultimately develop in the placenta. Um, so by day 7 after ovulation, the blastocyst is again attached to the endometrial layer inside the uterus there. So that inner cell mass of the blastocyst, that's this part here, is going to develop into three particular layers called the ectoderm, the endoderm, and the mesoderm. So the ectoderm is the outermost layer, which I think I've got blue here, and that's going to give rise to the nervous system and the epidermis of the skin. The endoderm, which is in yellow down here, that's going to give rise to the inside layer, which forms the mucosa and associated glands. So kind of the inside of your digestive tract on there. And then the mesoderm, which is everything in here, will form that middle layer, which gives rise to everything else. So muscles and connective tissue, and so on. Everything comes out of that. So here we can see kind of another image. This is inside the uterus. This is the implanted um, embryo on there. So we've got, this is that inner cell mass developing into the ectoderm, forming mesoderm and the endoderm, so the embryo there. Um, we'll point out a couple things. So there's a little bit that's still connected to what was that trophoblast. That's going to become the umbilical cord. And then what was the trophoblast will develop all these little things called chorionic villi, which will embed into the uterine lining. And that's going to become the placenta and allow for things to happen there. So after implantation, that trophoblast develops, as we just mentioned, as chorionic villi. They combine with tissues of the uterus to form the placenta. And then the amnion, which is kind of this fluid here around which this part here, around which the ectoderm, mesoderm, and endoderm kind of are attached. Pardon me. Is attached to the placenta by an umbilical cord. So the amnion is that fluid-filled sac that surrounds the developing embryo, and the umbilical cord contains that stalk of tissue that allows it to go back and forth. So here's an image developing embryo there, and you can see that umbilical cord going to the placenta going on it. But the key thing I wanted to point out was those chorionic villi that stick to the edge of that uterus and kind of intermesh with that tissue there. So the placenta, it forms a barrier between mother and embryo. Blood is not actually exchanged. It runs in capillaries right next to each other, so you can have diffusion of nutrients and oxygens and waste back and forth across of it. It does become an endocrine organ, and it takes over for the corpus luteum, producing estrogen, progesterone, and other hormones, and they maintain the pregnancy. Other organ systems are formed by the end of the 8th week after fertilization, and the activities of the fetus are growth and organ specialization. This is one of tremendous growth, so we looked at kind of that idea of going from week 8 to week 12, just kind of how much more it grew across that 1 month period there. So this next couple of slides show kind of the summary of changes here. So here again, we can look at some fetal development kind of from there to there. That's just a picture in your book. But by week 8, these are the changes that are accomplished on here. So we're starting to see, recognizable body parts for sure. A head, the liver, limbs, bone formation has begun. Heart's been pumping blood. All body systems are present in at least the rudimentary form, but also pretty small. Crown to rump is kind of top of the head to bottom of butt there. 22 millimeters, 0.9 inches, so almost an inch in length there. By end of week 12, right, head's still really large. Facial features begin to be more present. We start to get the visceral organs smoothing out there. Bone cell formation is beginning in the bone marrow. We're starting to identify whether or not we're looking at males or females there. Crown to lump at this point is 90 millimeters or 9 centimeters, which is about 4 inches, I think. Yeah, a little under 4 inches. So, okay. And then next setup, so here we're looking at 13 to 16 weeks. Sensory organs are present, eyes and ears, characteristic proportions and shapes. We start to get blinking and sucking motions of lips. Face starts to look more human. The body's starting to get larger at this point. Kidneys are kind of starting to work. Bones are distinct. Um, and again, much larger, 14 centimeters. And then 17 to 20 weeks, vernix caseosa, as his fatty secretions covers the body. Our whole body at some point is covered with this fine silk-like hair called lanugo. And then the fetal position with kind of the knees tucked in and the arms kind of in front is assumed just because of space constraints. And limbs reach kind of near close to former proportions at this point. And this is the quickening, which is where the mother can feel the movement of the fetus occurs. So now we're about 190 millimeters out there. It's 19 centimeters. 21 to 30 weeks, starting to put on mass. May potentially survive if premature, but the hypothalamus is not yet starting to regulate body weight or body temperature, so that's an issue there. And then surfactants in the lungs are inadequate, so the lungs can actually collapse. So we start to get myelination of the spinal cord. You can see bodies lean in proportion, fingernails and toenails are present. And then by 30 to 40 weeks, which is considered full term, bone marrow becomes the sole site of blood formation. Ideally, testes are going to descend into the scrotum in males, although that doesn't always happen. Some people are born with testes still in their abdominal cavity there. And the fat begins to be laid down in the subcutaneous tissue. And we're looking at approximate full-term length of 360 millimeters, 14 inches, and about 7 pounds, give or take a little bit. Okay, so what effects does pregnancy have on the mother? There's a lot. So obviously, enlargement of the uterus is a big one. We'll look at an image on that one. Another one that happens is lumbar curvature. So we talked about lordosis at the beginning of the year. So if you look in the image here, so the spine, the lower part of the spine, as pregnancy occurs, that center of mass is moved out further and further in front of the pelvis. And so that the lumbar portion of the spine assumes a greater curvature. In addition, we get the hormone relaxin starts to being produced, and so the pelvic ligaments and pelvic symphysis start to become a little bit looser there. This is showing kind of the changes in the size of the uterus throughout pregnancy. So again, I've heard it described as kind of pear size, pear shape, and then as pregnancy progresses, it can get larger and larger and larger. Gastrointestinal systems, morning sickness is pretty common. Heartburn is common because that uterus takes a lot of space in the abdominal cavity. It's much more likely that there's going to be some fluid that comes back up with that lower esophageal sphincter opens up. Constipation can be caused by declining motility, so there's less peristalsis, so things moving through because it's just everything gets tighter and tighter in there. Kidneys, you have increased production in urine because you're now filtering a lot more blood. In addition to the uterus actually sitting on top of the bladder, which can cause what's called stress incontinence. So urination just from the bladder sitting on top of there. Other things that can happen, nasal mucosa can become congested and swollen. Vital capacity and respiratory rates increase as we need more oxygen. This is called dyspnea during later stages of pregnancy. Someone experienced this in terms of, particularly at night, they have to sleep on their side. They find sleeping on their side easier. Cardiovascular system, blood volume itself actually increases by quite a bit. And so as a result, increased blood pressure and pregnancy varicose veins are common. Okay. And then finally we get towards the end of pregnancy, and parturition is the actual childbirth process itself. So labor is a term that we use for a series of events that expel the infant from the uterus. So this is rhythmic expulsive contractions of the uterus. It's a positive feedback mechanism. So once it starts, we want the labor to proceed all the way through. So estrogen levels rise, uterine contractions begin. Placenta releases hormones called prostaglandins, and oxytocin is released by the pituitary. The combined effects of all these hormones, particularly oxytocin and prostaglandin, increase and initiate the contractions and force the baby deeper into the pelvis, which further signals that it's time to continue on with the contractions of the uterus there. There are what's called Braxton Hicks contractions or false labor. They're relatively weak irregular uterine contractions that can begin before the actual labor process, and it's thought that they're kind of maybe like a warm-up to the actual contractions as the body's just kind of coordinating how to go about contracting the uterus and everything on there. All right, we'll skip back. That just talks about feedback loops. Okay, so here you can see kind of the baby is moving deeper into the birth canal, which preciosensors, so that's the pressure of the baby on the uterus. Remember the cervix is right down there. Sends signals up to the hypothalamus. The hypothalamus says, oh, there's increased pressure here. So it's going to send impulses to the posterior pituitary where oxytocin is stored. And that's going to release oxytocin, which is going to go to the uterus, which is going to cause increased contractions, which is going to push the baby further down, which causes more pressure, which keeps the signal loop increasing. Okay, so as we get ready for birth, there's dilation, so the cervix becomes more dilated, becomes bigger. Full dilation is considered about 10 centimeters or 4 inches, and uterine contractions begin to increase. The cervix also softens and effaces, which means it's thin. And then the amniotic sac, which was around the fetus, ruptures. This is known as breaking the water. And so water will come out of this fluid, this amniotic fluid will come out of the vagina. And a lot of women feel like maybe they urinated themselves, but it's not. It's the amniotic fluid that comes out. This part can last the longest. It says 6 to 12 hours, but I've heard extreme examples much longer than that, and I've heard examples much shorter than that. So I think there's a good bit of variation on there. So again, you can see the dilation. This is the cervix right here, and the vagina of the cervix right there. You can see that cervix needs to dilate wide enough for the fetus to pass through. And again, what else do we have? Uterus, umbilical cord, placenta in the back there. Yeah. So expulsion is the final stage here where we're actually going to pass the infant out through the cervix and the vagina. It can last quite a while, 2 hours. 50 minutes is kind of more average on there. On the first birth, 20 minutes on subsequent birth. Most babies normally are delivered head first. This is called the vertex position, but not always so. If they come kind of bottom first, that's called a breech presentation. And sometimes the medical technicians will have to sort of massage the abdomen of the mother to try to turn the baby around in different directions there. Here's just kind of this image showing the fetus coming out during the birth process there. After the baby comes out, then the placenta also comes out. This is the placental stage. Usually happens fairly quickly after the birth of an image. This is sometimes known as the afterbirth. Ideally, all the placental fragments come out at this time, although that's not always the case. So sometimes the medical professionals have to examine and make sure that everything did come out, because of those chorionic villi are attached so closely to that uterine wall that if they're not all removed, then bleeding can continue after the birth of the baby, and the mother is at risk at that point. Okay, so here's the placenta coming out and the umbilical cord coming out. Okay. In some cases, the baby can't come out vaginally, and so they have to do what's called a cesarean section birth. And so they'll cut through the abdominal wall to get that baby out. And so this just shows 3 different types of incisions that can be made for a C-section. We looked up images before, and there's actually a whole bunch. There's like several different types of incisions that can be made to try to get, depending on the way that the baby is oriented and so on, and where the placenta is. So some pregnancies terminate on their own. This is called a miscarriage if it happens kind of within the first 20 weeks. It's a fairly common form of pregnancy loss, and in many cases the cause of it can never be identified. So it could be that there was just something chromosomally not right with the developing fetus. It could be that there was hormonal problems from the fetal perspective or from the mother's perspective. It could be due to lifestyle. choices, drugs or smoking, improper implantations. There's lots of causes um, for why pregnancy doesn't go all the way through, and many, as we've mentioned, aren't ever really known. So kind of real quick, the developmental things. Gender is determined at fertilization. Males are XY and females are XX. So we talked last time about, or a while ago, about kind of the gonadal formation, kind of driving that towards either male or female reproductive anatomy, the primary sex characteristics, testosterone with the SRY chromosome gene on the chromosome are not there. Reproductive system generally is relatively inactive until childhood. And they don't really function for childbearing until puberty, which usually begins between 10 and 15, but can vary again, kind of depending. So some of the things that we'll see in males, the enlargement of the testes and scrotum. In females, budding breasts signal puberty. In menarche, we mentioned that before, it's the first menstrual period. It's usually about 2 years after the onset of breast development. And then at the very end of the menstrual kind of span for women, there's menopause, which is defined as when a whole year has passed without any menstruation. Ovaries stop functioning as endocrine glands are no longer producing estrogen or progesterone. Childbearing ability ends. There can be changes in body temperature, there's hot flashes, changes in mood. There's nothing equivalent to menopause in men, but there is over men who experience a steady decline in testosterone as they age. So that gets us through everything there, and then just kind of for next class, we'll focus on reviewing for the semester final. So thanks for listening, and we'll check in next time and review for the final. All right.